Hi everyone, it's Laura from Migraine Australia. Today we have a very special guest on the line with us. This is someone that a lot of people had put forward as someone they would like to hear from. So we're so very lucky to welcome on Dr Robert Boland-Freitas, a neurologist from Sydney North Neurology and Capital Neurology in Canberra. So welcome. Thank you so much for joining us. Would you like to tell us a little bit about yourself before we sort of get into the crux of CGRP treatment?
Sure. Thanks, Laura, for the opportunity to talk today. Well, I'm a neurologist. I have a clinical interest in migraine, and I have been fortunate enough to begin my career really at the same time as people have begun to get access to the group of medications we're talking about today. I guess I've gotten on in the ground floor, and I've now been using the medications for about 2 years, and hopefully I can answer some questions about that and be helpful in that regard.
Wonderful. All right. Well, thank you so much for sharing that with us. Our first question for those that didn't catch it before, we are going to be talking about CGRP treatment. And this is a big one. A lot of people don't know what it is. They've heard the terminology. So we're really sort of going to explore CGRP treatment. So can you please tell us what CGR treatment is?
Sure. Yeah, lots of alphabet soup in names of chemicals. CGRP stands for calcitonin gene-related peptide, and the treatments that actually are directed against that chemical because that seems to be an important chemical all throughout the brain, but particularly in the trigeminal ganglion, which is the area just outside the brain that processes all the sensory signals from the face. And then there are also some other related sensory areas that take in messages from people's necks. And CGRP appears to be an important chemical in people with migraine. And hence that's why the treatments have been directed against it and they've been designed to do that. But yeah, that's what CGRP means. Very sort of difficult to explain name, but an important chemical for migraine sufferers.
Perfect. So how do CGRPs work? How are they taken?
So at the moment, the ones that have made it to clinical practice are antibodies. And at the moment, we can't really give antibodies in tablet form. So they are injectable therapies. And that would have been something that would have been quite groundbreaking were it not for the last great breakthrough in migraine treatment, which was Botox therapy. But they now belong to that class. There are also, incidentally, some other CGRP-related medications on the way in the pipeline, which are tablets, but we might talk about that later. But basically, at the moment, they are medications that are administered by injection, either once a month or once every 3 months. And they typically are the 3 different preparations that are available. People typically inject the medication themselves into the skin of their thigh or their abdomen. And yeah, look, that's basically the way things are administered at the moment with CGRP therapies.
Perfect. And so what CGRPs are available in Australia and what are the differences between them?
Yeah. So I'll start by answering one very annoying but real thing is that we're not able to access these therapies on the PBS yet. And I don't know if you can still see me. My computer screen just stuffed up, so we might need to cut that.
No, you're all good. You're all good. We'll cut it out. That's fine.
So none of them are on the PBS, unfortunately. But we've been very fortunate in this country due to the pharmaceutical companies to have had access in varying schemes to 3 products, and they are the one that's been here the longest is called Aimovig. Then soon after that, probably about 12 months later, Ajovy came on the market, and very closely followed by Emgality. They have complicated chemical names, which are erenumab, fremanezumab, and galcanezumab, respectively. But
wow.
I think they're mouthfuls. So yeah, they're the 3 available. They have some chemical differences. Some really not sure how relevant that would be to most people who would be considering therapy with them, but just down to chemical structure. But I suppose the most important difference between the classes is that Aimovig is a bit unlike the other 2 in that Aimovig is aimed against the CGRP receptor, and the other two are aimed against the chemical or CGRP ligand.
Perfect. And so are CGRPs better than any other treatment, so opposed to some of the other medications on the market?
Yep. Sort of as a dovetailing into that last bit, which I forgot to mention, they all kind of, it's actually quite interesting how they're more the same than they are different, in that they are all administered sort of once a month. But your question was about CGRPs being, what were the side effects? Is that right?
Well, how are they better than other treatments?
How are they better than other treatments? Sure. So look, the way I really think about these being better is sort of on principle in a way. Clinically, they do appear to be quite effective drugs. But firstly, they are the first class of drugs that have made it to widespread clinical practice that were designed for migraine. They were not designed for anything else. They weren't found to be serendipitously useful just out of luck, like Botox was, even though that's still a very useful therapeutic in migraine. But there's a coherent path that you can follow back in the science that takes them from what they call bench to bedside. And so on that level, they are intrinsically appealing. But of course, it doesn't matter how intrinsically and theoretically appealing they are if they don't work, and they do appear to work. And so I guess, efficacy is there. The studies that have been done on all three agents that are available in Australia have demonstrated that people do achieve, on average, a significant reduction in their migraine days, even if they have very bad migraines or less bad migraines, so either chronic or high-frequency episodic. And what's more, though, it seems that they need less medication for this over time, which can only be a good thing, which does, it is all synergistic in improving quality of life. So yes, they work. The other appealing thing about CGRP receptor antibodies is that they don't tend to give the sort of classes of side effects that the classic anti-migraine prevention drugs do. And so that we think that the CGRP antibodies work outside the brain in the areas that don't do any thinking. So we're not dealing with generally bringing on depression. We're not thinking about inadvertently making people put on weight. We're not running the risks of some of the more sort of troublesome side effects that you get with the classic migraine medications.
And what about the risks? So we've said, obviously people know about the risks that go with some of the other preventatives, but are there any risks of CGRP treatment? Sure.
So the best answer to that is, and this is the biggest caveat with treatment with CGRPs, is that we just don't have that wealth of 20, 30 years to look back at the moment with regard to knowing how this is all going to pan out. The side effects that were apparent in the clinical trials, and in my clinical experience of about 2 years, those side effects seem to be very similar, were really more about constipation being a trouble for a sizable but significant minority of people. Also bearing in mind a lot of people with migraines suffer from irritable bowel syndrome. And also that was also particularly interestingly more of a problem with Aimovig than the other two ones, one of which Emgality is more likely to get on the PBS, fingers crossed. But aside from that, hair loss and some injection site reactions are other things, but typically they're minor, and they're not serious, and they don't necessarily mean the drug's not going to work or isn't useful. So, but yeah, look, I guess aside from those relatively minor sort of side effects that I've been able to observe, we don't have that, unfortunately, we don't yet have that wealth of experience to look back. And theoretically, and some people might be quite enthusiastic surfers of the web, there are a couple of pages which are written online that do propose a lot of questions about CGRP and side effects that can affect other areas of the body that we just really can't answer yet. But hopefully the degree of the blockage that we're inducing with the treatment is not as so profound as to affect other body systems in the way that people might be worried about from a theoretical standpoint. But for example, people are talking about potential effects on bone health, wound healing, on heart health, to name a number of things. There is a caveat, I guess, if someone has a really bad history of heart disease or lots of blockages in their arteries in their head or elsewhere, that maybe we'd stop and pause to think about starting CGRP receptor antibodies in those people. But as with everything, it's always something that's open to talking about and exactly finding out what risk we'd accept. So yeah, look, ask me again in 5 years, you might get a very different answer, a little bit less waffly.
No, that's really interesting to hear. So how would you decide if a patient was suitable for CGRP treatment? What sort of takes you from the level of going from a preventative to CGRP?
Yeah, so firstly, you mentioned that preventative medications. So look, generally people who will benefit from CGRP receptor antibodies are people who need a migraine preventer. Okay, so at the very least. So not everyone who suffers from migraines is going to need to require something as intensive as this, especially if people have type of migraine that can get on quickly and doesn't happen that often and doesn't cause any prolonged episodes or debilitation that you can really predict on a day-to-day basis, or that's something that's really preoccupying people. But if you are at that stage where you need a preventer, it's generally something that I would consider offering to people who have already trialed a number of preventative medications, much along the lines, I suppose, as Botox. However, it's important to note that the CGRP receptor antibodies also are proven to be effective in high frequency episodic migraine, which is not the case for Botox. So the general sort of way to look at it, I find, is it's often a choice between trying CGRP receptor antibodies or Botox once you've passed through a number of therapies which you've either had to give up due to inefficacy because it's not working, or because the side effects are too much, as we've talked about. So having said that, it's once you actually have a sit down and often think about this rationally, and a lot of people are, and understandably, are very attracted to the idea of a medication that's once a month, and that is not something that's going to give them psychotropic side effects, impact their appearance, impact how they get on with their day-to-day life. So I might start somebody, or give someone the option to start these medications, knowing that the PBS restrictions are in place, unfortunately, so it doesn't really matter how many things you've been through, quite early in the piece. I guess, although usually I'd be talking about starting something like this if the migraines were occurring and debilitating for more than 4 days per month, or caused really sort of disabling auras or things like that with them. But both chronic and episodic migraine patients can stand to benefit from using this medication.
Fabulous. All right. And so you mentioned before that there was some new CGRPs coming. So what is the new CGRPs coming soon?
Sure. Yeah. So they're tablets, and they're small molecules, and they're the Gepants class of medications. They are, to my understanding, they've been around for quite a while, more than a decade, and it seems like that some initial worries about safety issues regarding the liver have been ironed out with the latest molecule, but they are intended to be acute treatments for migraine, but they might end up having a niche in preventive treatments. I'm not sure yet. And yeah, look, they're on their way, and they are a group of medications that would be taken much in the vein of triptans. So the Maxalt, Imigran, Rizatrip, the Relpax type medications, and they're a bit safer in terms, perhaps, of coming with less of an inherent risk of causing vascular side effects. And yeah, look, they're on their way. They're exciting. People seem to be quite satisfied with them. Well, Gepants, it's called, in terms of acute migraine relief, 22 and 24 hours after taking them. They're not total game changers, unfortunately, even though CGRP antibodies have been really, really helpful for a number of people. But they look like they'll be occupying a different niche, but hopefully also useful alongside the new therapies, the antibodies as well.
Wonderful. Well, thank you so much for sharing all that information with us. I know I found it very useful. It is very interesting, sort of learn it, because we hear so much conversation around it in our support groups online and people's conversation, but to have you sort of spell it out like that in sort of such basic terminology is really helpful. So thank you so much for coming on and for sharing with us today.
My pleasure.